Thanks for joining us today. Welcome to the Center for State's video series on the 7 functions of intervention selection and design adaptation. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. In this module, we will discuss how teams decide whether to replicate or adapt an existing intervention or design a new one. As a reminder, teams should have already researched possible intervention options and assessed the evidence, fit, and feasibility of an intervention, and then determined whether interventions are well defined before deciding to replicate, adapt, or design a new one, and then moving on to define the intervention, develop a proposal, and then further define and operationalize the intervention as needed. The decision to replicate or adapt an existing intervention or design a new one is a critical step in the process of selecting an intervention. Teams need to determine if there's an existing intervention that is appropriate and whether it can be adapted to their system with little or no changes. To decide if there's an existing intervention that they may be able to adapt to better fit the target population, setting, and circumstances. And lastly, to determine if there are no existing interventions that can be replicated or adapted, whether there is a need and the capacity to design a new one. Let's move into some of the considerations that teams need to reflect on prior to making a decision. The continuum of fit, as described in the brief, moves from one extreme of finding an intervention that is a perfect fit to the other extreme of finding nothing that is even close to the needs of the agency in strategies, policies, or practice. In the middle of the continuum is where most agencies will end up. Pretty good fit describes when an agency will need to make only minor adjustments or adaptations to an existing intervention for a specific setting, context, and/or target population. Partial fit will likely involve major adjustments or adaptations to multiple components, or a mixture of adapting some components and then designing other ones that are completely new. When teams determine that a new intervention is necessary, they need to consider whether the agency has the time, commitment, and resources to devote to the development and design of a new intervention. As with other decisions in the change and implementation process, it is important that teams consult with key stakeholders about possible interventions under consideration. Be sure to include stakeholder representatives from groups who will be service recipients and/or target population, for example, youth for new programs addressing youth transitioning to adulthood, or relative caregivers for kinship support programs, or caseworkers and agency staff for agency interventions. Groups who will provide, coordinate, or oversee services, for example, caseworkers, program managers, private contractors, or community service providers. Groups who may also interact with or be affected by the intervention, for example, system partners, lawyers and judges, foster parents, and community service providers. Teams will want to reach a consensus about which direction to take. Replication of an intervention or minor adaptation, so after research and talking with program developers, teams may identify an evidence-supported intervention, or ESI, or a well-defined intervention that they can implement as is or with minor adaptations. This may be one of the ESIs from the directories consulted in Function 1, for example, nurse-family partnerships, parent-child interaction therapy, motivational interviewing, or another. This pathway aligns with one end of the continuum of fit, when teams find an existing intervention that is a perfect fit or pretty good fit. Adaptation of an intervention with major changes. Given the limitations of existing ESIs in child welfare, teams often will need to make adaptations to reflect their setting and population. This pathway aligns with the middle area of the continuum for interventions that are a partial fit. This may involve some adaptation and some new design or definition work. Design and development of a new intervention. After thorough research and careful consideration, if teams cannot identify an existing and appropriate, well-defined intervention, they may plan to design a new one. This pathway represents the other end of the continuum, when other interventions investigated are not even close and a new design is needed. What can help teams determine whether to replicate or adapt an existing intervention or design a new one? Consider the following as a team. Which existing intervention will best address the identified problem or need? Does the intervention need to be further defined, developed, or adapted to be culturally responsive and/or successfully implemented? If adaptable interventions are not available, is a new intervention needed? Is the agency able to fully commit the time and resources to adapting and implementing the ideal intervention? If not, is a different intervention needed? Have stakeholders provided input? Have team members come to consensus about the best intervention? Teams may have several good reasons for adapting an intervention, like addressing a population's distinct risk or to better engage the target population. It's important that teams weigh the benefits of adaptation against the risks of reducing the intervention's effectiveness, being mindful that adaptation may not be necessary. Consider whether the justification for adaptation might reflect bias or stereotypes rather than actual or meaningful differences between populations or context, and avoid choosing adaptation to make it easier, faster, or more convenient to implement, to stick to current practices and infrastructure, or to accommodate agency workers who are not familiar with new practices. Teams are encouraged to use data where possible to support their rationale for adaptation and to integrate evaluation into the change process to build the evidence base for the adapted intervention. As a reminder, there is only so much adaptation that an intervention's core components can withstand before they lose their integrity. When making the decision to adapt an intervention, teams should ask if the changes can be achieved through adaptation without compromising integrity and effectiveness. We've heard from other examples so far in this series, and it's time to hear about another one. Let's look at the example from step 4 in the brief. To improve acceptability among Mexican American families, a group of clinicians and researchers identified cultural adaptations for parent-child interaction therapy, an ESI with demonstrated effectiveness for young children with behavioral problems. The modified version, called Guindano a Niños Activos, or Guiding Active Children, was based on a 3-step process. Collecting information from clinical and empirical literature and interviews, and focus groups with Mexican American parents and therapists. This research explored such issues as attitudes towards treatment and related expectations. Developing proposed modifications based on the research. These modifications included reframing treatment as an educational skill-building intervention to respond to data that seeking mental health services may carry a stigma in the Mexican American community. Enhancing engagement protocols for immediate and extended family members to increase the likelihood of ongoing support. Allowing flexibility for certain practices to be described in terms that resonate with diverse parenting perspectives. For example, describing timeout space as either a punishment chair or a thinking chair. Translating and simplifying handouts and using more visual cues to accommodate individuals with lower education levels. And reviewing proposed modifications with a group of researchers with expertise in the adaptation of mental health treatments, a panel of Mexican American therapists that work clinically with Mexican American families, and the creator of PCIT. These adaptations left the core components intact while tailoring the intervention to improve acceptability and engagement of the target population. It sounds like the agency is considering all of the key factors as they make a decision about adaptation. Let's take a moment to check in on what you've learned about deciding to replicate or adapt an existing intervention or design a new one. Why do teams decide to replicate or adapt an existing intervention or design a new one? To determine if there's an existing intervention that meets the need, will meet the need with adaptations, or if the team needs to design a new one. How do teams decide to replicate or adapt an existing intervention or design a new one? By thinking through the continuum of fit, consulting with key stakeholders who will be impacted by the intervention, and reaching consensus as a group. What can help teams decide to replicate or adapt an existing intervention or design a new one? Ensuring that stakeholders provide input, that there is a team consensus about the best intervention, and ensuring that adaptations are not being made to stick to current practices or simply to make it easier, faster, or more convenient to implement. Now take this a step further by reviewing the reflection questions and practice exercise for decide to replicate or adapt an existing intervention or design a new one in your intervention selection, adaptation, and design workbook to connect what you've learned to your own experience. Up next is define the intervention, the fifth function in intervention selection, adaptation, and design.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P23320140033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.